Welcome to Relational Lives. We are going to talk about health anxiety today. Ali and I are going to chat about it, but we're particularly going to hear from Ali because as she's a cognitive behavioural therapist, she's got lots of ideas which can help people with health anxiety. So at the end of the episode, we will have our top takeaway tips. So stay with us and you'll have things that you can do to help yourself.
Hello, Ros.
Hi, Ali. How are you doing?
Yeah, I am good. I'm good. This is a bit weird, isn't it? We're recording in the evening rather than the morning.
We are. So whether we're
I've
not
had to wash my hair and everything.
Which you wouldn't normally.
No, well, I would have done yesterday, but I had to wash it after my run this morning. So
oh, I see. So it's back to front.
It's all a bit, yeah.
Well, it's doing me a favour because of journeying, isn't it?
Yeah.
So I'm very grateful for you washing your hair on a different time and a
You're
different day and coming in the evening. And it'll be interesting to see what we're like in an evening as opposed to a morning recording, won't it?
Yeah. So, health anxiety today.
Yes.
We've had a few people asking about health anxiety. And it can be, I think all anxiety disorders can be really debilitating.
Yeah.
And affects life in a big way, and particularly health anxiety. So I think this is a really good one to focus on. And for anyone that's listening or watching with health anxiety, I think it's going to be helpful for them to feel like this is a real thing. This is a really difficult thing to experience. And
because I think people, I don't know, you'll probably be able to tell us more about it, but I wonder what goes on for people who experience health anxiety within their friendship groups or families or whatever, in terms of whether they're sort of told they're hypochondriacs or, whether they're told things which aren't very helpful when, like you say, it feels a very, very real anxiety.
Yeah.
It is a very real anxiety and it feels
And people
horrible.
can actually joke about it, can't they, if you're someone in the family, oh, for goodness sake, stop doing that. Stop worrying about it.
Yeah. So Ali's a cognitive behavioural therapist, CBT therapist, and so health anxiety is often really helped with CBT. So I thought it would be helpful if we could ask Ali some questions today around health anxiety and how she might work using CBT. So if that's okay, Ali, could you perhaps tell us what is health anxiety?
Well, it's really a preoccupation with the thought or the belief that you may have or do have a serious illness. And of course, if you believe that you have a serious illness, that's going to cause anxiety, physical symptoms of anxiety, sometimes real panic.
Okay, so it can move from real anxiety into panic.
I mean, real anxiety is panic, but it's all, part of that experience of it. And it can be a real preoccupation with this idea that you're perhaps missing something, you think, oh God, am I missing something? Should I be going to the doctors? Shouldn't I? A complete preoccupation with what might I have.
So would it be something where somebody gets some kind of possible symptom or sees something on their body that looks like it might be something ominous, and is that what then will activate a series of thoughts and they might become anxious that it's something more than it is? How does it tend to present itself?
Well, I'm going to say a little bit more about that later, in terms of what triggers the anxiety, but I thought maybe if we could have a chat about what might lead to someone having health anxiety.
Okay, yeah.
I mean, the other treatment that's often offered for people with health anxiety is EMDR, eye movement desensitization and reprocessing, which we're both trained in.
We both do, yeah.
I think CBT is usually the first thing that's offered in the NHS.
Okay, and this is in the UK?
Yeah, in the UK. And it does have fairly good efficacy for treatment. But EMDR is another one.
So those are the two avenues that people could potentially explore. But like you say, why might somebody have health anxiety? Where does it potentially come from? And I guess that's where in the therapy that I would be doing with somebody, it would be looking at their history, looking at any experiences that they've had, where it would make sense, why they might make a link to being worried about health in the present.
Yeah.
So I think it's going to be interesting to see how CBT would be used, as it were, differently to perhaps how I would work.
Well, it would be the same kind of assessment. We're asking questions around what experiences have you had when you were growing up? What experiences have you had around illness, serious illness? And very often, I don't think I can remember any client with health anxiety that hasn't had something in their past where someone close to them has experienced a serious illness or they have.
Yeah. And so that would make so much sense, wouldn't it? That if they've had that close experience either with themselves or with somebody else, that it's naturally going to be something they're going to be more worried about or potentially more worried about.
Yeah. So it would be the same kind of thing, really. Let's look at the history, look at what's happened in your history, who's been ill, what was that like? What did you see? All those things.
And it could be therefore traumatic, couldn't it? And that's again, I guess, where the EMDR can be really helpful, can't it? In terms of going back into those experiences to kind of help process them where they haven't been before.
And just to acknowledge as well that if you're watching this, even hearing this can be quite triggering to someone with health anxiety. So we just want to acknowledge that. And hopefully you'll feel quite held and supported in this episode. Because we do have empathy for this experience. It's really unpleasant.
100%. Like you say, any anxiety, and this is just another one of them, which is really hard. And especially if you've not necessarily got the support around you and people are saying things that aren't very sympathetic, I think you can feel very isolated and alone with it, and then your worries potentially can become more, I guess, can't they?
Yeah, and if you've been to, sometimes it gets to the point where you're going to the doctors regularly and you then start to think, oh, is the doctor not taking me seriously?
Okay,
is my GP not taking me seriously? Can I trust them now? Are they just thinking this is health anxiety? So I think a lot of people, by the time they get to therapy, have quite a bit of mistrust in professionals' advice.
Because I guess potentially they're constantly told, no, there's nothing to worry about. No, it's nothing. No, it's...
Well, I mean, we'll go on to that later. Not always, but, if you're going to your GP a lot and the GP is starting to say, well, perhaps you have health anxiety, then you're going to start worrying, oh, God, are they just going to put everything down to health anxiety?
Oh, I see what you mean. Yeah, that makes sense. Yeah. So that, like you say, they'll then think that if something is missed, then they need to keep on top of it in order to make sure that somebody else, that they're spotting it rather than trusting somebody else will. Yeah. It's horrid, isn't it?
So let's go into what it's like to have health anxiety and what people might be experiencing. If you're watching this, you may be thinking, perhaps I have health anxiety, because a lot of the time people don't realise they have it.
Say more.
Well, because there is this strong belief that there is something wrong with them, that can be the belief, rather than this is an anxiety problem.
Oh, I see what you mean.
It's I'm missing something and I need to be anxious.
So it's there for a valid reason for them. It's nothing to do with anxiety in their minds.
Yeah, it's not until quite some time down the line often that someone's going to think, okay, maybe this is an anxiety problem.
And are you saying that it's then that they will potentially come and have some CBT with you? Is it at that end of the road kind of point?
Yeah. And quite often, I'll have someone come to me for health anxiety and they're still awaiting test results.
Okay.
And I would usually say at that point, let's wait till the test results come in, because until you've got that, you're still going to be perhaps thinking this is a genuine problem.
Yeah. So yes, so you would just check things out with them first. If they were waiting for tests, you would then wait for them to get those in.
Yeah.
And then what?
Well, because if someone's waiting for tests and they've come to see me, they're not really going to be engaged in this is an anxiety problem if they're still waiting to see if there's an actual problem, in terms of a physiological problem. So
sure,
I'll usually say, just let's pause it for now. Let's come back to it when you've got those test results. And all of the time they come back negative. Okay. And then we start.
So then they will come back to you, or they will be kind of seeing you while they're waiting for the test, or do you tend to say go away?
Either,
or is it varying?
Usually I'll say let's wait until we start, because otherwise they're still going to be in that more of a belief that, well, this still could be a thing, and they're not that engaged with the therapy.
That makes sense. Yeah.
So that's what we would do.
So people, in terms of the work similarly that we would do, we would look at people's histories, we would look at what's happening in terms of, or has happened in their past, which might relate to any possible health anxiety. So once, for instance, you've had somebody, they've had their tests done, everything's kind of clarified that they haven't got anything that's come up. Yeah. What then happens for you?
We'd need to really understand for someone coming, what's this like for you? What's your experience of it? Mm-hmm. What are the things that trigger your anxiety?
So you'll be looking at things in the present that are triggering their anxiety.
Yeah.
Yeah.
Yeah. And, it can be many, many things.
Mm-hmm.
Often it's normal bodily sensations that for us, we probably might not even notice.
Mm-hmm.
Or we notice and we just kind of go, oh, there's that funny thing again.
Mm-hmm.
I'm just thinking maybe, do you ever have heart palpitations?
Sometimes.
Yeah.
Yeah, sometimes.
Quite a few people have heart palpitations every now and then.
Mm-hmm.
To someone with health anxiety, that's going to shoot that adrenaline into the body and think, oh, what is this? Is this something really serious?
Is this something, remember we talked about I can't remember which episode it was, when we were talking about the watch thing. Is this something that can, I'm thinking of the heart thing. Monitoring. Yeah. Is this something that can feed into the anxiety for health?
Absolutely. Yeah. If you've got a smartwatch detecting your heart rate the whole time and you're continually checking it and you notice, it's gone up, or I've had people who are continually checking their blood pressure.
Okay.
And, if there's any sign of it going up, there's a panic.
And they always say with blood pressure anyway, don't they, even when going to the doctor or whatever, that you're supposed to not take the first one, because just even being somewhere with somebody else taking it, you can have a different reading, can't you? Whereas the third time it's absolutely fine.
Was it a white coat syndrome or something?
Yeah, something like that, isn't it? Yeah.
So moles are a common one for people that I've got loads of moles and freckles.
I'm molly too.
Yeah. And people can start to really be obsessing, preoccupied with what's happening with your skin, checking moles, measuring moles, taking photos of them.
So it becomes more obsessive.
Yeah, very obsessive. And the behaviours are a kind of way that someone is trying to reassure themselves that they're on top of it. They're looking out for changes.
That they're not missing anything.
They're not going to miss anything.
So it kind of makes sense again, doesn't it? That if you're fearful that something's wrong, that you're going to then keep looking and searching for more evidence on your body if it were moles, that something is wrong. And at least if you're on top of it, at least if you're checking and you're checking regularly. And I guess, is that something that you've noticed with people, it happens more, that the frequency of checking becomes more, is it increased, or is it?
Well, once we're working together, usually people learn to sort of drop it and notice it makes a big difference. But by the time people have come to CBT, Cognitive Behavioural Therapy, they are usually checking quite a lot. So it can be very extreme.
And I guess, again, they're not necessarily thinking of this as an anxiety anyway, are they, at that point?
Very often not, yeah.
So therefore, it's kind of a natural thing. I guess I need to keep an eye on this, and I'm going to keep keeping an eye on this.
Mm-hmm. Yeah. Other ones would be lumps, headaches. Sometimes just thoughts can trigger off your anxiety. You know, the thought that, oh my goodness, what if I have this? So lots of things can be triggers. There are external triggers as well. So sometimes you might hear a friend talking about a friend of a friend who's got a serious illness.
And will some of those, in terms of, for that to impact somebody, is it because they then fear that they might also have something similar, or is it that they recognise some of the symptoms or something that they might be experiencing?
Well, I don't think it's that thought out, you know. I think it's just as soon as they would hear that, if you're watching this and you have health anxiety, you probably know what I'm talking about. You've got almost a radar out for anything like that. So your body just goes straight into that. Yeah. That panic feeling. It could be something on the TV, something on the internet, something that pops up on your Instagram.
So it could be anywhere and anything, really.
Exactly. It's really difficult because it can be, you know, it's not like if you've got a phobia of snakes or lifts or something, you can pretty much avoid it and it doesn't really affect your life. But if you're walking around with your body...
and you're worried that that's carrying something which is wrong,
and you can't noticing
you can't get away from it, can you?
No. So it's horrible. It's a horrible thing to be dealing with. I mean, the great thing is, the hopeful thing is that there are really good psychological therapies to help with this.
So people don't have to continue feeling like they do, feeling that horrible anxiety, and understanding themselves more, understanding where it's come from, understanding what they're doing, and from what you're describing in terms of your work with CBT, changing those sort of behaviours and thought patterns that might come in, I guess. Yeah.
It's probably worth us talking about safety behaviours, which is a big part of many anxiety difficulties. So safety behaviours are the things that people do that give them short-term relief from their anxiety, and that then they believe that it's working. So I use the vampire metaphor with people. I don't know. Have you come
I've done that one as well. Yes, I've used it too.
Yeah. So it's imagine that you have a friend who's absolutely terrified of vampires, and every night they lay out the garlic, the holy water. What else is it? They keep the light on.
Yes. Those are the main ones, I think, aren't they? All the things that you're going to kind of keep vampires away. Everything that you've heard to keep vampires away.
And your friend says to you, well, they work, right? Because I haven't yet been killed by vampires. So these safety behaviours work. So the first step with that friend would be to help them, firstly, cognitively, give them a little bit of a wriggle room in their belief. Well, have you heard of anyone that's been killed by vampires? You know anyone? I don't keep holy water and I'm okay. So you kind of start by giving them a little bit of a window of maybe this isn't actually right. Because then they might be willing to drop those behaviours and test it out.
So how might safety behaviours present themselves with health anxiety specifically?
Well, checking. So using the mole one, it's a safety behaviour. So the reason I've not got cancer is because I check all the time and I keep on top of it. And
of course there's an element of this which is important, isn't it, where there's the truth. Like there's a part of it where a certain amount of checking of certain things is a helpful thing. And I guess it's where it goes over into something which isn't helpful and isn't, is into the anxiety, I guess, isn't it?
Yeah, and we work with that as well.
It's where that balance is, I guess, isn't it?
Absolutely. But so safety behaviour with health anxiety could be checking. Very common one is doing internet searches.
And that's so easy now, isn't it? I don't know anybody who probably doesn't do that if they're worried about something, worried about anything. Google
or
got
search
AI
engines
now. And AI,
yeah. But actually, it's interesting because a lot of the time, people are quite willing to drop that one quite quickly.
Are they?
Because they realise it actually makes their anxiety worse.
So they're noticing themselves, what they're feeling when they're doing it, and are happy to give that up. Okay.
Yeah.
And do people find it easy? I mean, that you're saying they find that quite easy to do. Are there any elements that people find more difficult in terms of their safety behaviours to give up?
Well, yes, there's lots of other safety behaviours. So, there's the going to the doctors or other professionals to get things checked, try and seek reassurance. There's asking friends for reassurance. Touching, so if someone thinks that they have a lump, so for example, if you have a swollen gland or something, they'll be touching it lots to sort of, okay, is it changed? Is it bigger?
And I guess with some of these things, when we do have something, even if it's not necessarily a gland or if it's a mole or something, that the more it's touched, the more it's then irritated, I guess, isn't it? The more sore it becomes, the more that then is sort of bringing some evidence, I guess, is it, that something is wrong?
Yeah, I think, it's the same with a lot of the safety behaviours. And when we come to the takeaway tips, this is going to be important. It's, okay, this is why you do this. You're trying to get reassurance. You're trying to calm your anxiety down, which of course you want to do. And sometimes you get that short-term relief, right? You might Google it and it might say, oh, don't, that's not a thing. In which case you get, oh, okay, I'm okay. Until the next time when you then have to do it again. And other times you might find you come across something that makes your anxiety 100 times worse. So with any safety behaviour, there's often short-term relief, but long-term it doesn't make any difference. But many of the safety behaviours also come with negative consequences. So you talked about the palpating the neck, making it, which might make it even more sore or red, or swollen. So then, of course, oh my God, it's worse.
Something is worse, yeah. And that's going to increase the anxiety and sort of giving it almost evidence again, isn't it? Something, well, look, something is wrong. Yeah. Look what it's doing.
Yeah. Or touching at moles and things, you could be, I've got a mole there. Touching it and that makes it red. Or so it usually safety behaviours are, at best, provide short-term relief. At worst, they actually make the anxiety worse. So looking at that is going to be really important to actually someone being willing to say, okay, I'll give it a go.
Okay, so that's sort of challenging those safety behaviours. And then I guess, would you take it sort of one by one in your work with somebody? Would you look at the behaviours that they're doing, the safety behaviours that they're doing, and then decide between you together which one they're prepared to have a go at?
Yeah, because, ideally drop all of them, but most people aren't willing to do that.
Because I imagine that's a hard thing. I would feel that if I don't experience health anxiety, fortunately, I'm lucky. But if I did, I can imagine that if I was told I'd have to stop all these things, which I knew, even if it was a short-term thing, keeping me safe, I'd think I'd find that hard. Giving them all up at once. You'd
be the friend that's going, I'm not getting rid of the garlic.
Well, I might be prepared to get rid of the garlic, but I might not be prepared to get rid of the holy water or something. It's like I think I'd want to do it gradually.
Yeah, which is fine. And the problem with it is that all the while you've got a safety behaviour, you can be attributing that to the reason that you're safe.
So are there some people that you work with who will be happy to drop all in one go? No. So it's quite unusual, I should think, isn't it? So it's just about taking time. And I suppose the system has been, in the body and the mind and the emotions have been there for such a long time, probably building up, haven't they? Yeah. Especially when they come into therapy, people experiencing this. It's not going to be just this very, very quick fix, is it? Where a couple of sessions and, you're out and you're fine again.
No. But I find that the dropping of safety behaviours has such a big impact on people because it keeps the anxiety going. And we know that, I mean, if you listen to our other one on anxiety, we know that anxiety comes with a whole host of physiological symptoms,
which contributes, doesn't it?
Contribute to the cycle of, oh my goodness, there's something wrong.
Yeah.
So I think, you know, it's one of the biggest things that I find helps people feel even just that little bit better and less anxious.
Yeah. So really getting people, I guess, is it to tune into, can you say a bit what happens in terms of that process of inviting people to drop those safety behaviours, and then kind of what you help them do, as it were, to help themselves with that? What would you do?
Well, this is what I love about CBT, because we would actually set it up as an experiment. We would set up an experiment. So if we use the not doing an internet search, for example. So let's say someone is doing an internet search at least twice a day on their symptom, whatever the focus is at that point, because it moves around for people, by the way.
What do you mean?
That 1 month it may be moles, the next month
I see what you mean. So the health focus, health anxiety focus will move around. Okay.
Yeah, so let's say they're doing their Google searching. Other search engines are available.
Yes.
They're doing their Google searching, and we set up an experiment to say, okay, how anxious do you feel currently? Rate it. After you've done your Google search, rate it out of 10, 0 being not anxious, 10 being the most you can imagine. So we'd get that for a week, and then we'd say, okay, let's try a week where you don't do any. And let's see what happens to your anxiety then. So
will you again invite people to score it again so that they've got a different experience? Yeah. And does it help in terms of, I think in my experience it does, but in terms of externalising what they're doing, actually putting it into something where somebody is writing something down, that noticing, I guess you're bringing into such a different awareness, aren't you?
Yeah. I think that's a really good point, Ros. It's the writing down. It is, isn't it? It's getting it out of your head, because especially when you're anxious, it's like really hard to focus and remember.
Well, by the very nature of it, because as we know, and again, you know, if people want to go back and look at or listen to the anxiety episode that we did before, it makes so much sense, doesn't it? That when we feel anxious, we don't have our prefrontal cortex, our thinking executive brain online at all, do we? And so therefore, of course, it's hard, isn't it, to think straight. It is actually impossible to think straight. So I guess that writing down, giving a sort of purposeful activity almost, isn't it, to how someone can help themselves with this must be in itself, I don't know, is it comforting? I don't know, but certainly externalising and bringing into awareness.
Because actually writing down, it brings your prefrontal cortex online as well. You know.
So you're connecting it up, and your anxiety hopefully will reduce. Yeah. That makes so much sense.
And I was just thinking, we're talking about anxiety a lot here, but quite often people end up depressed.
Say some more about that.
Because the anxiety, the whole health preoccupation becomes such a focus that the rest of life enjoyment drops away, and things get like people are focusing so much on it that they don't do the things that give them pleasure and enjoyment, which then leads to low mood, depression, hopelessness.
Yeah. So that can become even harder, can't it?
And even just saying those words,
you
can feel the energy.
It, can't you? It's like, gosh, it's so hard. Yeah.
So it's, let me say it again, it's just such a difficult condition to be managing.
And as Ali said earlier, hopefully you can really hear that, you know, we really understand that. It's really, really tough.
And the other aspect of it, again, we've mentioned this in, I think it was the anxiety one. Other episodes are available. Many.
But only one Relational Lives.
Our episodes. Intolerance of uncertainty is underlying this as well. This whole difficulty with not knowing for sure feeds it.
I think I think everybody can relate to not knowing. It doesn't even necessarily have to be related to health, does it? But that whole element of not knowing, that period of not knowing, is really hard, isn't it? So again, like you say, that uncertainty. And so what do you notice with people who have health anxiety? What do they do in that period? Is that where all the safety behaviours come in? Yeah.
Any sign of uncertainty. I mean, even going to the doctors, right? If someone goes, I don't know if you've ever done it, right? I went to have a scan for something, and you're looking at what the facial expression on the what do they call them? Sonographer.
Oh, right, yes.
Is it sonographer? Anyway,
yes.
The person's face.
Like, technician.
Is their face, if they've seen something? You know, things like that.
Yeah.
Or a doctor being a little bit vague about something.
Yes.
Oh, you know, everything's fine, but come back in a few weeks and I'll check it just to make sure.
So that, again, is no certainty. It's not like, no, it's nothing.
Yeah. And even if it is, no, it's nothing. If you've been to the doctors and they've said, absolutely fine, your bloods are fine, everything's good, you might leave the doctors and think, oh, I forgot to tell them about that other thing. And
that might be the thing that's the most important that you think you've missed, that they will then not know about, which means then you've got something. Yeah. You can see how it spirals, can't you?
Absolute spiral, yeah. And you're never, you know, this is the thing with the intolerance of uncertainty. We are never, there's always uncertainty. Always.
And it's how we learn to live with that uncertainty, isn't it? What do we do to help ourselves rather than feel anxious? Yeah.
Which brings me to a strand of CBT called acceptance and commitment therapy, which I really love. And I think there's relevance here with health anxiety because acceptance and commitment therapy, a part of the focus is on what are your values. And if we flip someone's fear over to the opposite side of the coin, we usually find something that they value. And with health anxiety, there is a value of life and health and living.
Living to a fulfilling and healthy life. Yeah.
So if we can flip that and someone can recognise that's their value, they want to live a good life, they want to, it's then about, okay, how do you focus on that?
So that would be brought in, would it, in terms of at what stage, for instance, would you bring that, or would it be at the beginning anyway, so that you've got this kind of goal?
I think at the beginning. I think at the beginning, because it also, you know, when you flip that coin over, it also gives people hope. Oh yeah, this is important to me. And I'm completely not focusing on that. I'm completely focused.
I was going to say a lovely contrast to hopelessness, isn't it? And, you know, if somebody has become depressed alongside their health anxiety, then that's going to be a lovely possibility, isn't it? To bring in a balance, to bring in something else. And really helpful for people. I think, you know, I love that whole thing with ACT and that notion that of really understanding values, which change, don't they, through our lives, and what is really important to somebody. And I can imagine that when a focus has been in one area, like health anxiety, and that's so all-encompassing, like you say, you're never away from your body and it's constantly there, that must be such a nice thing for people to start to explore and check into, because it might be that they haven't done that for a long time.
And you know, at the initial stages, most people are too anxious to do that, but at least there is that little kind of, okay, this is a thing. How can we help you to put more time, more energy in how you do want to live your life?
So that's a lovely balance, I guess, isn't it? To when I was saying, what do you do in terms of the safety behaviours, and you were saying it's start challenging, experimenting, putting in the scaling of how anxious people feel when they're doing it, but also this focus of what can be replaced in a way, what can come instead of all of this.
If you're not focusing all your time, thoughts and energy on that, what can you be focusing on?
And that in itself, again, if you think of how we felt just between us when you were talking about depression, and how we're feeling now when you're talking about hope, and looking at those values or whatever, looking at the other side, flipping the coin, as you say, it feels different, doesn't it?
Yeah, absolutely. So I think that does give people some hope and something to aim for as well.
Mm-hmm.
So what can you do if you're listening to this or watching this and you have health anxiety? Ideally, in an ideal world, some psychological therapy, some CBT and or EMDR would be great.
If people can't afford it privately, which I think, again, this is one of the reasons on this why we do this podcast, because we're really aware that not everybody can access private therapy of any kind. So if somebody doesn't have the money to go privately, CBT is something that's very recognised, isn't it, within NHS? I would imagine what I would say is that people need to go and see their GP.
Yes.
I mean, this is a tricky one in some respects, isn't it? Because I guess
they might not trust their GP.
They might not trust their GP. But if this resonates with you in any way, it might be worth you going to see your GP and saying you think maybe that you have health anxiety, and could you be put forward for some CBT sessions, because that should be free. The trouble at the moment is that there are huge waiting lists, and I know that's really hard, and hopefully some of the stuff that you're sharing with us today, Ali, will be something that if people are on a long waiting list and can't afford therapy themselves, that they might be able to start experimenting with themselves.
Yeah, and there are some great self-help books out there. I mean, the one that I'm recommending today is called Overcoming Health Anxiety, which is by, I can't remember.
We can put it into the show notes.
Yes, we will.
There's a whole series in those Overcoming books, isn't there?
Yeah, but they're really good. And I was looking at it on Amazon yesterday. I haven't actually got that one, but they are good books. And the reviews are really good by people that have got health anxiety. So
it's really hearing people's experience. That's so good, isn't it, when there are reviews rather than from professionals, from people who are actually experiencing and have read it or whatever. We'll put the name of that and the authors or whatever into the show notes.
Yeah, and the thing about self-help, though, I just want to point out is don't just read it. Take it in, read it slowly, and actually do the exercises in the books.
Yeah, that's so important, isn't it?
Yeah, because otherwise it's not going to help as much.
Well, it just becomes an exercise in your sort of intellectual sort of thing, doesn't it? It's not actually getting your body, emotions and everything else involved. And also, I guess in that book, I know that you say you haven't got it, but I imagine with your knowledge of all those books, there are exercises for people to go through. So that's going to be really important to follow. And like you say, I think with all these, whenever we make recommendations with books, I think that point that you've said, Ali, of reading them really slowly is vital. Just take your time, don't rush it, don't feel like, I just want to get rid of this.
Read the book and it'll be done. Yeah.
Or feel like, I just want to get rid of this health anxiety, and so I just want to get to the end. It's like, it's taking time, isn't it?
Yeah. Some people read through the whole thing and then they go back and do it slowly, which is fine.
But it's like you say, the point is doing the experiments, isn't it? The point is doing the actual exercises.
Yeah, absolutely.
So yes, you were saying that if somebody is experiencing health anxiety, I mean, I sort of interrupted you in terms of what if somebody can't afford it, but hopefully getting some form of psychological help. If they can't, start with the self-help book. What else would you recommend to people?
Stay tuned for our takeaway tips coming very soon. But, it's the beginning part is, as usual, it's that awareness of recognizing, okay, this might be a thing for me, that this is an anxiety problem, and that's what I need to help with, rather than focusing on trying to get certainty and
the answers.
Yeah, so there's a thing called Theory A, Theory B, which is often used in OCD or health anxiety.
We'll do another episode on OCD sometime.
We will. Theory A is what anxiety tells you. So Theory A would be, there is a serious problem that I am missing and I need to keep my eye on the ball. and therefore I have to do all these things and all these checks. That's theory A.
Mm-hmm.
Theory B, I worry that I have a serious illness, which creates anxiety, which creates a vicious cycle, and that's where my focus needs to be at.
Okay.
And often people are very ambivalent when they first come with that theory A, theory B.
Okay. So therefore helpful for people to see those two avenues, as it were.
And that's probably in that CBT health self-help book, actually.
Okay. So again, helpful to perhaps get that. And also, again, I'm aware that books are expensive, and, it might be that your local library can supply it. Even if they haven't got it in stock, it's worth going to your local library. Yeah.
So let's go to our 3 takeaway tips. There's 3 tips that we're going to give you to start the process, really.
So number 1 is to learn about the normal fluctuations in your bodily symptoms. Notice what's normal for you, and also notice what's normal perhaps for everybody. And it might be worth, for instance, if you're experiencing something in your body, that it's worth checking with friends to see if they experience the same thing, to see if you can normalise it in any way.
Mm-hmm. Number 2, write down all the ways that you currently behave to try to reduce your anxiety and gain certainty. So those safety behaviours. I want you to write them down. And I also want you to write down the unintended consequence. And in other words, what's the negative thing about that safety behaviour? Then, if you're ready to, I want you to try dropping one of them and notice the difference in your anxiety or your preoccupation. And then number 3, let's find out what your value is on the other side of your anxiety. What is important about your health? Why is it important to you? Is it because you want to live a good life? Is it because you want to enjoy life? Find out the value and then see if that can be your focus.
Great. Ali, thank you. I think it's going to have been a really helpful episode for people.
You're welcome. Thank you for asking the questions.
Health anxiety. And yes, we'll look forward to other ones in the future. And I know that OCD one is something that's been requested, hasn't it? So we will do that at some point. So thank you.
See you soon.
See you soon.